On behalf of LIRNEasia, really happy to have all of you here, familiar faces and some new ones. We're going to talk all day about what this so-called information disorder is and talk about this term. This is sort of towards the end of a research project that has gone on for about 2 years, but the issue of the information disorder is something LIRNEasia has been working on for over 5 years now, and all of us in Sri Lanka have lived with the problems caused by misinformation and disinformation. Well, that's me. My name is Helani. I'm the CEO of LIRNEasia. And for those who don't know, LIRNEasia is an independent think tank. We've been around since 2004. Right now, we work in 21 countries across the Asia Pacific. That's South Asia, Southeast Asia, and the Pacific Islands. Although now we seem to be working in a small way on AI stuff in New Zealand and Australia as well, but the 21 countries are where we normally work in. And we call ourselves pro-poor, pro-market. And that means very specific things to us. Pro-poor, obviously, is that those who are marginalized, particularly economically, but in other ways, whose lives should be improved as a result of our work. And pro-market is a reflection of the fact that not often can states be good and efficient providers of services. You need markets, but you particularly need competitive markets where the entry barriers and competition for the market and competition in the market are high. And in our early days, we did a lot of digital policy regulation, particularly in telecommunications, where we know that after years of waiting for landline phones, private sector investment is what got us the mobile phones. So it was a market entry. However, we also know that today where we live in is not necessarily competitive markets, because these are hugely dominated by large platforms, and it's very hard for anyone to enter these markets or compete in the market. So we try as much as possible to move these things, right, in various ways. So hence the pro-poor, pro-market. Right. So my job is just to give you a very brief introduction of what the information disorder is and why we care, and to set the context. So you all know more than we do, because many of you are in media and working in this, that we live in quite a complex information ecosystem with complex interactions of humans, technology, power, economics, and politics. All of these things interact. There are media systems, there are organizations from private sector, public sector, civil society, and into all of this, a lot of technology has come and a lot of data is happening. So a healthy ecosystem, and this is common terminology that you'll see in sort of UN language as well. It's a well-functioning and diverse. So the first feature is that it is diverse, that there's a plurality of ideas. Information is created, shared, and used. That is, you can do all of these three things responsibly. That is, you worry about what the effect of the information is. But of course, we all have different motivations. Private sector wants money, power wants influence and power, and so on. So the ecosystem of actors change this. It's not always necessarily healthy. And depending on your power, money, and other things, the ability to influence and sort of pollute in a positive way or negative way this ecosystem is very different. We all have different levels of ability to influence this. An unhealthy ecosystem, we know, is one where data is not shared, bad data is out there, it's causing problems, and it has a couple of consequences, right? One is that most people don't know what on earth to believe. So there's a general mistrust in information and a mistrust in institutions. We see this because now in Sri Lanka, when you watch news, you need to know about the politics and the ownership of the news channel in order to interpret for yourself whether that's a reasonable representation of what actually happened, right? So generally mistrust in media, mistrust in also other institutions, right? Mistrust among people, and in obviously in the worst cases, we have people dying, right? Now, many people say that Facebook and the information spread through it caused death in Myanmar, right, of the Rakhine people. Some can argue, yes, that's what happened. Some can argue that Facebook was just the distribution mechanism, the mistrust and the hatred was among the people. But the point is the information ecosystem is now almost weaponized and is a tool. And in response to this, what governments are doing is trying to combat supposedly the information disorder and therefore curbing on our speech, because they are going to decide in many cases whether what you say is true or not. So we have a complex, problematic situation at this point. So this term I've been using, the information disorder, is something that comes from about 2017. In a way, a recognition that we are talking about a complex situation of misinformation, disinformation, malinformation, hate speech, and a whole lot of things. And this was the time, if you remember, Trump started coming and saying everything is fake news, which is a whole contradictory thing. Fake and news are not supposed to be together. So these are problematic terms. So in mostly starting with academics, this term, the information disorder, started coming to encompass all of these things, right? Because the falseness of information can be intentional or unintentional, intended to cause harm or not to cause harm. So it can be the creator who intended it. It can be perfectly good information misinterpreted by the reader. So there's complexities, but the point is information disorder is a catch-all term. Now, we will use this term today. We can call it the information disorder. We'll also sometimes say misinformation, if you'll see in the presentation. But the point is, we are talking about this large phenomenon and not making a differentiation today between malinformation and misinformation and so on. So if you hear us saying disinformation, misinformation, we are talking about this basket, yeah? Right. So the information ecosystem thrives on a series of factors. So you can think of these as loops that influence one to the other, and if you get it right, you have a healthy system. If not, you have a vicious cycle and a really unhealthy system. So we know these are markets, particularly when it comes to digital media. The more users there are, the more valuable it is. You want to be on Facebook because most of your friends are on Facebook. That's network effects, right? This works. But the more users there are on a particular network, the more valuable it is for advertisers because they want to now be on the network to reach you, right? So it's a two-sided market. So when there are more users and more advertisers, it's great for the platform because they get users, which means all their data is there. They get advertisers, which means all their money goes to the platform, right? So this is what creates these huge platforms like Amazon, Facebook, Twitter, where it's very difficult for anyone else to come and compete. It's also in part because advertisers, when it comes to this information disorder, most advertisers will tell you that when they advertise on a platform, they care that their ad is not placed on a website or a platform or social media next to, let's say, child pornography content, human trafficking, violent content. Very few advertisers will check if their ad, banner ad or any Facebook ad is coming next to true content, right? Verifiable content. So it's not a very discerning market when it comes to anything other than those categories of information. So advertisers are not discerning and therefore the money keeps flowing into these platforms. And of course then you have power and politics where people know that this can be exploited, right? And then we also have the phenomena of the laws which generally across the world try to put the responsibility of content moderation on the platform. So you can imagine the scale at which information is coming online and the resources required to moderate all the content across all languages. Who can do it? Only the really rich platforms can afford to employ fact checkers, run the data centers to like check these facts and so on, right? So it's again reinforcing that cycle of market concentration. And we have these business models that reinforces that. We have jurisdictional issues because we are trying to pass laws that are overseas. All of this is because the most valuable commodity today is your attention span. That is what every marketer, every politician, that's what they want. And it's a limited resource because there's only so much your human brain can process. So humans are at the very center of this, and everyone is competing for your attention, and many have figured out ways in which to grab your attention. That is in part why the information disorder thrives, this ecosystem of problematic interactions. And we're going to talk after lunch about solutions. So actually, even in our first presentation, so we know there are different categories of solutions, right? One is law and regulation related. We know we try to pass laws. Countries that have economic power can order a Seattle-based social network platform to take down content, right? Like Germany does, and impose huge fines like the EU does. Countries like Sri Lanka pass laws where it's more about controlling the creator, the poster of the content, that is about controlling you and your interactions, because it's very difficult for them to control a company outside. But there are different variations of it, quite problematic. Then there's content production and distribution related solutions. That is, guidelines that social media networks have by themselves, code of conduct, community guidelines, which say you can or cannot do these kinds of posts, right? And they can take it down if you are participating on their network. Journalism and traditional media houses will have editorial policies. The New York Times says 3 independent verifications of a fact before it's published, and so on. So these are self-imposed codes of conduct individually or as an industry, right? The press industry might have some. Then platforms also do other things, which is labeling. We all saw during COVID-19, particularly if a tweet, I think in most countries, had COVID-19 and somebody was trying to sell some, kasaya that was supposed to cure it, there might be a label, say this is unverified. That means they can't establish the truth. And in other countries, it said, please go to the government website, and it gave a link, like the National Institute of Health or NHS England or whatever, right? So that's labeling. That is just warning the user, and I think that's a meaningful activity, so at least the user knows. Second is algorithmic deprioritization. That is unverifiable information you don't show on the first page, right? And you show it on the second or third, so you really have to scroll down in order to do this. The other one, of course, is just pure content takedown. That is, somebody sends a court order and they take down the content, or a president's media unit calls the local Facebook person and they take the content down. So content takedown does happen. And then demonetizing and advertising related responses, that is again trying to enforce. So for example, political campaigns in some countries, when they are advertising, have to say this is a political ad and it is endorsed by certain people. So advertising regulation related responses. So that's about creation and distribution. Then there's independent fact checking. So we've been studying this for a while in Asia, Africa, Latin America, and the Middle East. So we saw when we did that 80-country study, fact checking is is the most common solution that people see to the problem of misinformation. There's a large number of fact checkers, some who are paid by the big platforms and keeping them in employment. Great, because they are doing a service, so they tag content and it goes back to the platform. They possibly take some action. But others, who you will hear from today, also put it out to us, public, so that we can also search and figure out whether that's correct or not. And they put it out in the form of websites, newspaper articles, WhatsApp groups, and so on. So independent fact checking. The problem is we don't know the impact of fact checking. And interestingly, a lot of fact checkers either are dependent on the big platforms for funding. They are employing people who are there for a very short term. Like after A-levels, they go do some fact checking, and then when the next job comes, because it's not long-term employment. So you don't build up a narrative or expertise in a particular topic, right? These are short-term things. And it's unsure what the impact of these things are. Then there is another category that believes humans are the most important thing. Let's worry about changing their hearts, minds, and brains. Let's change norms and give them media, digital literacy, and so on, so they understand that maybe they're being manipulated, they understand what AI is and how easy it is to create images, and so on. So a lot of initiatives like this happen across the world with many variations. Again, the impacts are unknown, and we don't know whether sort of we are getting the benefit for the kind of effort that is, and we actually definitely don't know whether this particular form of teaching people is the right way to go. So we know, for example, Norway has taken a stand, I think from grade 5 or year 5. People are taught about what it means for a fact to be true, the probability of something is true, what is knowing, and so on, right? We don't know, again, the impacts of that, but they have done it at a national curriculum level. So today is about understanding this phenomena in Sri Lanka, and there are many ways of knowing. This is LIRNEasia's way of trying to understand whether our people can actually tell truth from fiction, and we will talk about that. We do a national survey, and importantly, we don't just look at whether men can tell truth from better than women, not the demographic, rich versus poor. We look at psychological factors, because there's a lot of theory now coming out how stuff in our brain, the way we think, have a lot to do with what we believe and whether we initially believe something that we see or whether we critically assess, this left brain, right brain things, right? So we did a lot of that kind of testing as well. Then we will talk to you about 5 separate interventions of the type I talked about: media literacy, digital literacy, fact-checking, and see if they're effective. Now, our point here is not to say, oh, they're effective or not, is to sort of bring out the point that we do really need to understand whether they are, right? So that we can work with the partners that we work with to make them better at changing people's hearts and minds. So today, we will start off with 2 presentations. We will then have the first panel, and that's all before lunch, where we will talk about the interventions, what's going on in Sri Lanka, what can we do better, etc. And some of our partners who are amazing are here, and they're going to be on stage. We're then going to have lunch and come back to a panel moderated by Nalaka on media, right? What is the role of the journalist, and what are the new media business models, and how is it helping or completely messing up in the context of this information disorder? Then we will move immediately to a session on AI. How does algorithms and data and scale and machines play in all of these: creation, distribution, identification of misinformation? Now you'll notice we are not talking about law and policy intentionally, because honestly, we have been talking about law and policy, particularly in the context of the Online Safety Act, now for about a year, and there's still conversations going on, because it looks like the government is sort of maybe thinking about changing some things or repealing, who knows, but all of you all know the conversations there. That's a whole day we can spend on ourselves, but we are not going to talk in detail about the law and policies. There are plenty of other forums, including ours, which really do talk about the legal stuff. So we will focus on not necessarily the legal, the other stuff, although we will touch on it. Thank you for listening. I now invite Shenali, who's going to walk us through the national survey. Thanks.
Hi everyone, so I'm Shenali, and I will be taking you all through our approach to this study, and I'll also take you through some of our findings from the national survey. Yeah, so when we looked at the kind of work that has been done on this topic, there's quite a lot of literature on it, right? But we identified a few gaps. One of them is that a lot of the research done on this area comes from these Western educated, industrialized, rich and democratic countries. And that's of the problem, especially work related to, say, the psychological or behavioral factors that influence your ability to identify misinformation, but also on the solutions. And by that I mean studies that use an experimental setting to test the effectiveness of various interventions, right? So Of course, there is some work from countries like India and Pakistan, but these are still scarce and far in between. So there is sort of a need to conduct research on this in our specific context, because what may have worked somewhere else might not translate well to the conditions here, right? Another thing we see is that a lot of the research kind of zones in on a very kind of narrow topic. So, for example, they'll discuss political misinformation or misinformation related to COVID-19. But again, that narrows our understanding, and it kind of ignores the complexity of this phenomenon like Helani discussed, because most of these topics are sort of broad and interlinked with each other. So to address some of these gaps, we've done a mixed method study where we first did some informative qualitatives where we spoke to over 80 people to get a sense of how to even design this national survey and to run our questionnaires and our research materials through them. So then we actually conducted a nationally representative survey, speaking to over 2,500 people. We were able to produce estimates at a 95% confidence interval and a 3.3% margin of error. Then we used some of our findings from here as a basis to do an experimental study where we did the study to be as scientifically rigorous as possible, and we tested out 5 interventions that are related to media literacy and fact-checking to see how effective they were. And we wanted to get a better sense of some of our findings from these experimental studies, so we went back and spoke to a smaller group of these participants in our experimental study to put our findings into context. So I will be taking you through the second one, which is a nationally representative survey. So what we've done in the survey is testing someone's ability to identify misinformation. And there are various ways to do this. So our approach was using cue cards or pieces of news that mimic the kind of media that you come across online or offline. And we ask people to essentially classify them according to their truthfulness. We've chosen 3 topics. So we have news related to the economy, some news related to ethno-religious topics, some news related to climate. And we understand that these are not completely independent topics, and they also interact with each other, and they have like a political angle sometimes. They'll be tied to broader themes around like governance, inequality, and things like that. And we kept all of this in mind when we designed these cue cards. And we've also categorized them on 4 levels of truthfulness, essentially, because the news that we see on the media are rarely completely true and completely false, and sometimes they can be in the middle. So we worked on these cards with Appendix or Watchdog, who are an experienced team of researchers and journalists who already had a sense of the kind of news that comes across in the media and a sense of the kind of misinformation narratives that are common as well. So we piloted all of these cue cards before we actually used them, and we refined them according to what we found. So when we first did our desk research, and we also did these qualitatives before we started the national survey, we found that the Tamil and Sinhala media is different, right? In the kind of players that are on these and the kind of news that are prominently featured, the kind of thing that goes viral, and various cultural factors that influence these media ecosystems. So it wasn't quite fair for us to use the same set of cards and expect everyone to be able to categorize them correctly. So based on that, we split our sample into 2, and we asked people to choose if they want to see the cards in what language they wanted to see the cards in, hoping that they would choose the language that they usually look at their information and news on. So this is what our cards looked like. So we had, again, like I said, the climate, economic, and ethno-religious topics, and then we had true, mostly, false, and false cards from each, and it was made out of 40 cards, which we presented in a randomized order. And in order to actually analyze what this says about a person's ability, we had to assign scores. And this is our scoring matrix where, for example, if a person classifies a true card as true, we would give them 3 points. If they classify a true card as mostly true, we would give them 2 points. And if they classify a true card as false, we would give them no points. So as such, the lowest possible that was possible, the lowest score that was possible for a responder to get was 20, and the highest was 120. This is also what our cue cards looked like. For example, the one that you see on the screen is one from the economic category. It's completely fabricated, so it's a false card. So now, before I come and talk about what we can tell on people's ability based on these cue cards, let's talk a little bit more on the context. How do people interact with news and information? How do they share, verify, and so on? So we see that a lot of people say that they share news with others. So over 80% of people say that they share news with other people. And surprisingly, a lot of them also claim to verify most of what they see online before they share. So this is certainly surprising, but there is some sense, we can at least see that there's some sense that there needs to be some caution before you pass things on to other people. So we also asked people about if they know that they have been receiving false news in the past, right? And about 66% of people said that they know that they have received false information in the past. And when we asked them how they know that they have received, like how did they know this news was false, a lot of them say that they asked their family or friends, or they checked it against offline sources such as newspaper, radio, and TV. So again, you see some kind of verification happening, but the way people understand verification is broad and diverse. So, and it likely depends on sort of what is available to them and who they trust and so on. So, looking at some of our qualitative findings, again, this is kind of what we kept hearing about how people verify information. They mentioned that if you look at what Uma Devi and Nimal is saying, they talk about fake pages, and they say that they look for official and verified pages to find news. And then there are others like Ishara, who will look at the comments and see the debates that are happening there and use those social cues to sort of make a decision on what's true and what's not. And then there is Satish, who looks for consistency across platforms. So if he sees the same piece of news on multiple platforms, then they take that as an indication that this piece of news is true. And then there's Dasun, who has some sense that some of the information that he sees online are incomplete. So he goes to more longer form content channels like YouTube to find the full story. So a lot of this verifying behavior is also shaped by trust, and we wanted to understand what people trust. And when we ask people what they consider when they decide to trust a piece of information, a lot of them talk about the source they get it from, whether it comes from TV or radio or social media. And then others talk about how that piece of news being shared by their close family and friends, and also it aligning what they already know. For example, Well, let's go back to the trust that is shaped by where they get it from. We wanted to understand if some sources were seen to be more trustworthy than others. So it seems that there is more trust in these legacy media such as TV, radio, and newspapers compared to what's coming from social media like YouTube and Facebook. So interestingly, now we spoke about people that share news, and we spoke about how people say that they know that they have been getting this false information. We asked them, do you knowingly now share this information when you know it's false? And a majority of those people say that they do share it. And that is done for all kinds of reasons. The main one being that they want to tell other people that it's not true, but also because it gave a positive message or they wanted to create a discussion. So it's not just about, believing what they see, but it's also about what the content does. Does it entertain, or does it provoke someone, or does it spread a good message? And that context really shapes why people share information. So then we asked people, okay, so you're saying you've gotten all this false information in the past. You're also saying you will pass on some of this false information. How confident are you of the ability to tell these true and false news apart? And a majority of them say that they find it hard to identify which news is true and which ones are false. But then there's still that 45% of these Sinhala news consumers who say that they can easily identify it. So let's see if they actually can. So again, I spoke about those scores, and I told you all that the lowest possible score to get is 20 and the highest is 120. What we see is that they aren't particularly skilled at identifying misinformation. The scores are between 48 to 99. And we wanted to see if there were patterns. Are they better at identifying certain types of information as true or false better? So we've done this analysis. I'll just explain the chart really quick. We've arranged our cue cards that we used in order of truthfulness. So you see the true cards, the mostly true, mostly false, and false cards. And if everyone did a perfect job on each of the cards, you'll see those little dots at 3, right? But they haven't. So what we see is that the true and mostly true cards have a higher average score compared to the false and mostly false cards. So what this shows us is that people are better at identifying true information as true compared to identifying false information as false. So we want to know what characteristics sort of shape this ability to identify misinformation. And when you look at the literature, there's been a mix of these demographic, like age and income, and then these psychological factors like how you think and your impulsivity, emotion, things like that, and then your political ideology, social media use, so many factors. So this is not even an exhaustive list. And even though they are in separate boxes, they're not independent of each other, and they will sort of interact and influence each other. For example, there will be some findings that younger individuals with more digital literacy are better at identifying misinformation, and then there will be other studies that find that older people are actually better. And that's really shaped by how the study is conducted and the context that it is done in. So we would have liked to understand all of these factors and see what exactly the picture is here. But doing that is extremely difficult for various reasons. For example, some of these things like emotion it will require us to sort of dedicate an entire module to understand a person's emotional state before we actually conduct our survey, which is not really viable within this 1.5 hour survey, and it's just not practical to do that at scale. And then there are other issues as well. For example, things like narcissism. So they have established psychometric scales for us to use when we are trying to measure it, but it's not being validated cross-culturally. For example, narcissism in a very individualistic society can look a lot different can manifest in a very much different way in like a more communal society. So before the psychology literature, validates it here and we have something to work with, we can't really measure that kind of thing. So we've tried to measure as many as we can. And the ones in red are the ones that we have captured. The ones in gray are the ones that we haven't. And the pink ones are some that we've partially captured. So let's start with one of the contextual ones, which is where people get their information from. There are some studies that show that it depends, like exposure to some types of misinformation is more on social media as opposed to mainstream news. For example, they've tested a panel of misinformation on COVID-19 and looked at how frequently it appears on social media compared to other sources like TV and the press, and it has seemingly appeared on social media more frequently. So this might not really be applicable to Sri Lanka, but in general, social media would sort of it'll give you access to a stream of information that is not easy for you to verify at the frequency and scale that you get it from. So that is also shaped by mobile phones. Mobile phones is an important factor because it also gives you that like instant ability to access news and then take actions like sharing or verifying it. So we see that a lot of people, 88% use mobile phones, and about 58% of them also use smartphones. But when we ask people where they get their information from, it mostly comes from, they mostly get it from Sri Lankan TV channels and their peer networks. Social media is also used, but not to that extent to get news. And when we asked people what kind of social media they use, they report using WhatsApp, YouTube, and Facebook more. So the next one is understanding how media works, or what's called procedural news knowledge, which means like knowing, for example, how news is produced, and digital literacy. And this is also studied to be linked to it's linked to being able to tell between true and false news. And well, the findings are not uniform across studies. So some studies find that digital literacy is actually not very impactful, and other things like information literacy plays a bigger role. But this also has a lot to do with how these things are defined and measured. But in general, digital literacy can be a solution. And there are people that would propose boosting digital literacy as a way to counter the information disorder. So we've used a DCS recommended question, and we find that the population is split between those who have no digital literacy and those who have a very advanced level of digital literacy. So what this means is basically we've asked people whether they've used an internet-connected device in the past 6 months to search for, to evaluate, to store, and share data and information in a retrievable manner. And the ones who don't have any digital literacy have not done any of these things. And the ones who have advanced level of digital literacy have done at least 2 of them. Then on to this procedural news knowledge, or knowing how the media business models work. We've asked people about how they know why these Facebook posts, how the Facebook posts that they see on their phones happen to be there. And a lot of them say that it happens at random, or they don't know how it works. And when we asked about advertising dependency of media channels, about 41% of them said that, answered it correctly, but a majority either didn't know or gave a wrong answer. So what this means is that people aren't very cognizant about the commercial dynamics that shape how news is selected and presented to them. We've also looked at polarization, which is the tendency for people's attitudes and beliefs to become sort of more extreme and move further away from each other. And it matters because it amplifies your negative feelings about the other group. So it'll skew your judgment about when it comes to information about them, right? So in most of the work that we looked at, they looked at political polarization along ideological lines, so liberals and conservatives. But in Sri Lanka, where party politics is more fluid, there was some evidence that polarization happens more along ethnic and religious lines. For instance, when we looked at the barometer survey data from 2021 and 2023, and they are asked about identity, a majority of people in both of these years identify themselves along ethnic lines as opposed to other forms of group identity. So we have tried to measure polarization using two measures, right? So one is to understand general feelings of prejudice or trust in the people in the other group to do what is right. And to get a sense of discrimination, we've used this social distance measure that looks at how comfortable people are with scenarios involving people of the other group. So being a neighbor with them, marrying into their community, buying goods from them, receiving medical care, and so on. And what we see is that the claimed polarization levels are moderate along ethnic and religious lines. And going specifically into that social distance measure, we see that people are more comfortable with the other group. So in this case, the other ethnic group in more professional settings, like getting treated by them at a hospital or buying food or groceries from them, compared to interpersonal relationships like living with them or marrying into their communities. And this trend is sort of repeated when we asked about religious groups as well. We've also looked at trust in institutions, which is also seen to be something that will influence your ability to identify certain types of misinformation. So there are studies that show, for example, that people with higher levels of trust in their public health authorities were less likely to believe misinformation on COVID-19, for example. So we've tried to measure people's trust in key social institutions. And so we see that trust in religious institutions is quite high, and comparatively there is less trust in the national government and police and so on. Then we've also looked at actively open-minded thinking, which means a person's tendency to look for evidence when they're forming beliefs or revising them. And again, there are studies that show that when people claim to be more open-minded, they were less likely to fall for misinformation. And we've used this actively open-minded thinking about evidence scale to get a sense of that. And what we see is that majority of the people fall somewhere in the middle. And so that means they're not really open-minded, but not quite close-minded as well. And the last thing we looked at is on how a person arrives at conclusions, right? So how do people think? Behavioral economists talk about thinking fast and thinking slow, right? And the idea is that your initial intuitive answer is then sort of corrected by a more measured, slower, and analytical response. This is also what is called System 1 and System 2 thinking, where System 1 is that intuitive wrong answer, and the System 2 thinking is that more analytical thinking, right? And the CRT is a test that is commonly used to measure this because it is composed of questions that have this, instinctive wrong answer, but if you really think about it, the answer is different, right? So using this, we see that a lot of people are these intuitive, fast thinkers and not and the slow and analytical thinkers are less common. So let's now look at the relationship between all of these factors that we spoke about, and what do they have to do with your ability to identify misinformation. To do that, we have conducted what's called a two-step clustering, and we've clustered all of our people into the low scorers, the moderate scorers, and high scorers. And most of the people are moderate scorers. So we earlier spoke about how people were better at identifying true information, right? So this is the same chart from then. The only difference is now you see 3 dots for people who in our clusters were in the high ability cluster, the moderate scorer cluster, and the low scoring cluster. And you see in the true cards section, there's a lot of overlap between those scores, the cluster, the high scorers, moderate scorers, and low scorers. So what we understood by this is that correctly identifying these true cards doesn't change based on which scorer group you belong to. And even the low scorers are good at identifying this true information. And we wanted to sort of dive into that and see how people classify true information. So it seems that these low scorers are almost defined by accepting true information as true. For example, if you look at the low scorers box here, 54% of them would correctly categorize true cards as true. But also 59% of them would categorize mostly false cards also as true. In comparison, the high scorers are more skeptical. So only 38% of them even correctly classified true cards as true. So this kind of gives us an understanding of what these clusters or what these scorer groups actually mean. And so now we'll look at who are in these clusters, what kind of people are in these clusters. So we'll start off with the internet and device use, right? So we see that the high scorers are mostly mobile phone users and social media users. If you look at demographics, there are people from younger age groups. And they are also from higher socioeconomic classifications. If you look at their literacies, they have an advanced level of digital literacy, and they have tertiary education. If you look at their psychological or cognitive factors, you can see that there are more system 2 thinking people there. There are less polarized people there. They are more open-minded, and somehow they also have less trust in the national government and religious institutions. And if you look at their behaviors, that is also different. We see that they use search engines and foreign news websites more. They also tend to cross-check information from multiple sources before they share information. They trust information that are backed by experts and by cross-verification between multiple sources and sort of looking at consistency. And the low scorer profile is different, right? And in their behaviors, we see that they use local news websites and websites like Gossip Lanka more. They would rely on personal networks to verify news before they share it. And they trusted information that's verified by local leadership and their family members. So I'm aware that I just laid out a lot of information here in a very small period of time. So if there were to be takeaways, I would say these are the main things, right? These Sinhala news consumers were overall not very skilled at identifying the truthfulness of information, but in general, they were better at identifying true information when compared to false information. We see that ability is shaped by multiple human factors, and we've looked at some of them. We see that majority tend towards system 1 thinking, where they are more intuitive and fast thinkers. The religious and ethnic sort of polarization levels are moderate, and the population is split between those with no digital literacy and those with an advanced level of digital literacy. So we also saw then that those with high ability to correctly identify the truthfulness of information they had more digital literacy, they were more slower and analytical thinkers, they were more open-minded and less polarized when compared to low scorers. So yeah, that was our first cut of our data analysis, and there's a lot that can be done with this data. I'll hand over to my colleague Isuru, who will now talk about solutions and what we can do with all of this.
Thank you, Shenali. What I'm gonna talk with you or share with you the findings. Those are from the experimental study that Shenali and Helani explained previously. So anyone would agree that if you can improve people's before that, just a small notice. This conversation can be trilingual, that you can use English, Sinhala, or Tamil. So interpretation services are available. So if you need a device, please feel free to pick one from either from one of our LIRNEasia staff or other interpretation service assistants are there. Thank you. Right. So anyone would agree that if you can improve people's ability to identify misinformation, that's a good sign of all the solutions that you will be suggesting to counter misinformation. So in this experimental study, actually, what we did, we tried to understand the effectiveness of certain solutions that you have out there. So basically, my focus is on the darker color boxes there. So some of these solutions are placed according to like how difficult those are to implement, and also how long will it take to have a real impact. So if you take a solution like digital literacy, will take like sometimes very limited time to see an impact, and also you can say it is easy to implement. But if you take improving knowledge on the media information landscape, that might require a lot of resources than doing a digital literacy program. And same with trust in news and information, you require a lot of resources for that, and also the impact will take a lot of time to see. So there are multiple solutions out there. Some organizations, even representing here, roll out such solutions. So those can be digital literacy programs, media literacy programs, or you might be working to improve the trust in news and information. So the actions or the training or the activities you will be doing kind of like digital literacy trainings, media literacy trainings, and news verification groups and fact-checking platforms. Those are the things that do. So all those things we can cluster into two. You can start with like user-centric actions. So your target, your audience is the users. Then you do fact-checking initiatives. Some of participants here also represent those fact-checking organizations. So in our experimental study, we try to understand what would work better to improve people's ability to identify misinformation. So for this experimental study, we had 1,529 persons as respondents, those who went through the experiment. So selecting those was informed, or the insights for that, selecting people, their demographics and all those things, derived from the national survey that Shenali explained. This experimental study we did in 4 provinces: Northern Province, Eastern Province, Western, and the Southern Province. So the findings that I'm going to share with you from these 802 Sinhala news consumers. Apart from that, we had 727 Tamil news consumers, but those findings are not included in this presentation. So let me explain you how the experimental study happened. So as I said you earlier, all the experimental study participants were pre-recruited, and we told them to come to a central test location on a particular day and a time. Once they came to the test location, they were exposed to this baseline evaluation, which had the cue cards that, kind of like cue cards that Shenali explained. The cue cards we used for the experimental were different, but all other things that Shenali explained related to the themes and also the scoring methods all were the same for the experimental study as well. So they exposed to this baseline evaluation there, where they identified, they were told to identify certain news information as true, false, mostly false or mostly true. Then they went for these interventions. Those interventions I will explain you later. So there were 5 kind of such interventions. So immediately after the intervention, the same respondents were assigned randomly for the interventions, and then they face the respondents face the immediate post-intervention evaluation. Sorry. So that was in the test center immediately after the intervention, or the solutions in our fact-checking or the countering misinformation word. So again, they were asked to, the respondents were asked to classify 40 cue cards, different to the baseline cue cards. Then after 14 days, our data enumerators went to households of those who went through the experimental study and did same kind of cue card classification with a few more other questions. So after the data analysis and all that happened, so it took after about 3 to 4 months, again, we selected few respondents, those who took part in the experimental study, and we went back to them, their households, and asked about like what they think about the intervention and how these some of like changes happened in their information behavior in that 3 months, we would say. So these are the 5 interventions that we used or we tested or like in our experimental study. So I will explain you one by one. Our research partners are here, those who actually contributed for implementing these or developing some of these interventions. So I will start with in-person training. It has been doing by Sarvodaya Fusion for many months, years. So we thought that since it is out there already, why don't we use it as one of interventions in the experimental study? So it was basically like a classroom training. So 126 our participants of the experimental study went through that 45 minutes classroom training. Then the video, it was an educational video that you see on this screen on your right-hand side, developed by Verite Research. So there 133 persons went through that video during that intervention. So it explains, as you see on that screen there, like how do you identify misinformation, what are the good practices of identifying those and all those things. Those who exposed to that intervention watched that video for about 15 minutes. All 3 languages used in that intervention. And the game developed by Marga Institute, I think Fahim is here somewhere. Yes. So that game is actually a choice-based narrative. That game also you can see behind these cubicles. You can play if you wish. So 141 respondents went through that intervention. So while you are playing that game, you get some, tips and good practices of identifying misinformation and how do you react to those misinformation and all that. So it's an educational game. Then WhatsApp group that has been doing by Sri Lanka Press Institute for many months and years. So we got them to got them also in this research. So 137 our experimental study participants were members of this fact-checking WhatsApp group that SLPI maintains. So for about 14 days, these experimental study participants had the opportunity of going through the WhatsApp group. So at the intervention, the test center, they were given, the respondents who were selected for the WhatsApp group intervention, they were given 10 to 15 minutes to go through the WhatsApp group and see what was posted, what messages, what news items were fact-checked by SLPI. The website, it is a Factor Center website that we used for the intervention. So why we selected Factor Center is that it is trilingual. It has all Sinhala, Tamil, and English fact-check news. So during the intervention, we gave 15 to 20 minutes for our experimental study participants, and 131 people or the respondents were exposed to that intervention. So apart from all these 5 interventions, we had a control group as well. So there are 134 participants were there. Right. So then from here onwards, most of my findings I'll be sharing with you based on these 2 types of evaluation scores that I'm going to explain you. So their ability to classify information as true, false, or mostly false, that was tested in 3 stages, as you see here. That's baseline, immediate post-evaluation, and the 14 days post-evaluation. So when I in my next few slides, when I say short-term improvement of a respondent of the experimental study, what I meant by that is, as you know, once they received the test center, the participants, they were given the baseline evaluation. So the score between the baseline evaluation and the evaluation that they face, the respondents face immediately after exposing to the intervention, is what we call short-term improvement. So that's the first level of improvement that we calculated. Then the second is what we call midterm improvement. Again, we go to the baseline scores, and that score is calculated with the scores that that particular respondent received after 14 days of the Q card classification that they had. So those terms I will be using, short-term improvement and the medium-term improvement, when I'm explaining the findings of this experimental study. So Q cards, I don't want to explain those things again. The same thematic information themes that we used for the experimental study also. So 40 Q cards at one time. So respondents actually categorized 120 Q cards, and the scoring methods was the same, and the classification of Q cards, as Shenali explained, true, mostly false, and false. Oh, right. Now the big question is, did those interventions could improve anything, like identifying information or categorizing information as true, mostly false, or false? That's the results of the experimental study. So this is what actually we saw. On your left-hand side, the x-axis is to show you the scores that received by these the experimental study participants, and the y-axis is to show you the different interventions that I explained you, including the control group on your extreme right. So the darker color bar shows you the baseline evaluation score on your extreme left-hand side, and then next to that, in-person training, the immediate post-evaluation scores that you see. And next to that, you see I'm talking about the in-person training, the lighter color one, again, 14 days post-evaluation scores. So, likewise, for all the interventions, the scores are given here. So actually, what do you see? There is only like marginally improvements across all the interventions. That's what you see. Closer look at the same data. Now you see the differences slightly better because the scale is slightly different to the previous slide. So what do you see? Ability to improve only like marginally improved across these all the interventions. But interestingly, you see the control group, which had not exposed to any of the interventions, that is declining. So that's saying something about the interventions. So now we know that what I showed you earlier is not like convincing for some people, those who wanted to know things about statistics and also the experimental studies, the whole process that you follow when you analyze data. So that's why we use 3 statistical tests. So the first one is a statistical significant test. This is, if I explain it in simple words, that's to see whether the changes, the improvements, whatever you saw in the previous bar, is not just a random thing. It is statistically someone can convince that it is happening not because of a chance, but there is something there. So that's why we did a statistical significant test. Then we did effect sizes. So effect sizes are to see like what is the magnitude of the improvement or the changes that you see from one phase to the other. For example, from the baseline to the midterm immediate evaluation, you might see a improvement, but what is the effect size? What's the magnitude of that? Then power analysis. The power analysis we did just to see whether the tools that we used for this experimental study are good enough to convince particularly a statistical audience. For example, the sample sizes are good enough to say something about the results that we are getting. So in my next few slides, I will be using those symbols, as you see, 1 star to say the statistical significance at 0.05. That means if you see a 1 star, that means that the changes, the results you are seeing there it's kind of like a small chance of, there is small chance of that results happen by chance or random, but likely there is a real effect. If you see 2 stars, then that means there's very strong statistical evidence to show that these changes, what we see in the analysis, is real, not a random thing that happened. Then medium effect sizes, if you see 1 cross mark, that means the change, the improvement or decline that you see is clear and noticeable. There is a medium effect in those interventions. And 2 crosses, if you see, that's high effect size, the changes are big and very much noticeable. And the other one, hashtag, just to show you the acceptable power. So that means we have used the correct tool, and also we have, for example, like enough sample sizes to come to those conclusions. Right. So now these the red color and the orange color for you to show you the short-term improvement and the medium-term improvement of these tests. So what we see here, that some ability improvement we improved, we saw in certain interventions. For example, video had a good improvement. So comparing to short-term and medium-term in evaluations. But you see the control group, it is declining, those who didn't expose to any of the interventions. But you don't see any kind of like statistical, evidence or the things to prove there, because you don't see any of those stars hashtags on the bar charts. Right, so then we had an issue because we wanted to explain these interventions, how these can have an impact on improving people's ability. So then we disaggregated the topics. As you know, we used topics of the cue cards. So we had climate change cue cards, economic cue cards, and also the ethno-religious cue cards. So each bar you see here is to show like the improvement on one cue cards, the scores on short term or on the medium term. So as you clearly see, climate change is, you see that there is very limited like improvement, or sometimes it is declining. But if you take the other two information sources, like other cue cards, economic cards and the ethno-religious cards, you see there are some sort of improvement with the interventions that they had. So what does this mean? People want a different skill to identify climate change related misinformation, or are they much familiar with or identifying information related to economics and ethno-religious compared to climate change information? Those are the things that we need to think of. And so since of this like kind of like a difference that you see according to the information themes, so we took the climate change separately, climate change related information separately, and did all these statistical analysis, and also did the calculations for short term and mid-term improvements. So as you clearly see, doesn't matter which intervention you expose to, if the information is related to climate change, people shows less improvement in identifying misinformation related to climate change topics. And as you see, some of those are really statistically significant. That's why we have those symbols there. So that means this is not a random thing that had happened. It is statistically can be proven. Now, what we did here is that since now if you put the climate change with all other information sources, that won't give you a clear picture. So we divided the information themes, and we took economic and ethno-religious information together. Those are together, and excluded the climate change information. Here, then, you see the improvements in all the interventions, more or less, I would say. So some are statistically significant. For example, if you take the video, the midterm improvement is really high, and it has statistical validity as well. And also the in-person training was like showing improvements for the economic and ethno-religious information. But again, you see this extreme right corner, the control group is keep on like declining. That also says something about the value of the interventions. Right, now I'm going to kind of like summarize some of like findings that we gathered from all the analysis. So here on your left hand extreme corner of this table, you see all the interventions. Then the column right to that is all information. That means you put all the information together, all three types, climate change, ethno-religious and economic. And then other three columns, information themes subdivided as climate change information, economic, ethno-religious. And the extreme right corner is to show you ethno-religious plus economic information. So what you see, as I explained earlier, if you put all the informations together, then none of these interventions work better. So that's why those the shells are gray color. And then for climate change, none of these interventions worked. Then you go by economic information. So what does this mean? In-person training has an impact on the on short-term improvements on identifying economic information. And there is one star there So that means that it is significant at 0.05. So like that, if you go to ethno-religious information, going from in-person training, so it is yellow color. That means you have improvement in the short term and the long term as well. And it is statistically significant at 0 as well. And also it has 2+ marks. That means it has high effect sizes as well. So that's how you read this draft, the table. So this is kind of a summary of some of findings according to the information themes that we presented or asked respondents to classify in the experimental study. So I know the solutions are targeting particular information themes to counter misinformation. For example, some might work on economic related misinformation, some might work on climate change related misinformation. So the previous table was to show you if you are working on a particular informed thematic area, then what are the pluses and minuses that can be in your different kind of interventions. So again, some might be working on targeting different demographics. Some might target digital literacy programs for females. Some might target for senior citizens, like that. So this is to show you how these interventions had an impact on different demographic factors. So reading this table, in-person training, it worked well in short-term improvements. That's why the color is red if you take the rural areas. So in summary, in-person training, rural areas, it works well. So that's how you read this. For some age groups, in-person training works well. That's the age group between 46 to 65 with some statistically significance as well in the improvement of those experimental study participants' ability to classify misinformation. So I told you about the qualitative studies that we did. So we had focus group discussions and in-depth interviews as well. So let me share some of those findings with you. So we did those qualitative data collection in Sinhala and in Tamil as well, in Colombo and in Jaffna. So we selected those who participated for the experimental study, and after analyzing their individual scores, we identified, okay, this person had done extremely well in the interventions, in the Q card classification. So we had some sort of like a understanding of the scorings of those people that we interviewed from the qualitative data collection. So we tried to get feedback on the interventions that they exposed to, and also what sort of like behaviors they had in the past after they exposed to the interventions. That's what we tried to capture from the qualitative interviews. So they came up with their past experiences. So now I would say when you talk to them after they exposed to the interventions, they know that there are things called political propaganda, AI manipulated informations, because those were the things that we taught them or we exposed them to during the intervention. So they clearly told about those things in the follow-up interviews. And AI edited content, they are familiar with that. And so some of them had used digital tools that we promoted or introduced in our interventions. And also they had done a good job of preventing others for being victims of misinformation, because apparently they had shared their learnings with their family members, their friends and all that, and also in their WhatsApp groups, which has like sometimes over 1,000 members. And also they had they showed that kind of like a lower trust in social media. So because it probably, I can't say for sure, but it can be due to, because from the interventions, we said that don't believe things at glance when you see something on social media. So they said that some kind of like skepticism is there. Okay. So then we ask about what kind of like interventions or the solutions or the training programs that they would like to have to gain knowledge on these things. So they said they would rather have tailor sessions by age, by gender, that sort of feedback they gave. And also they said that even there are fact-checking websites out there, they don't always feel like log on to or see those or search those fact-checking websites and see whether this particular information is true or false. Rather, they would like, kind of like WhatsApp kind of a communication method by those things. Then also, especially in the in-person training and the game that we exposed to the participants, they said that if you include practical examples, so like contemporary examples and all that, and what they see generally on social media and those things, if they can use it, that would help them. And yes, and frequent follow-ups from those whoever do the interventions. It can be in-person training or a fact-checking website or something like that. Follow-up that they would require. Right. So what are the implications? So this is, next I'm going to share with you some of like reflections after doing all this national experimental, all that study, qualitative and all that, what we actually learned, and some of our, kind of like findings that I want to share. So, and it is kind of like trying to explain that some of limitations of the research that we did. So we selected these interventions because many people think those are the solutions, the 5 interventions that I told you. And so it is implemented, widely accepted by many countries. That's why we selected that, because anyone can ask, why didn't you tested this particular solution or intervention? So what we understood that there is no single solution that works for everyone. So customization is needed. So some intervention worked well for certain demographics, and also some intervention worked well for certain information themes. So, so actually many interventions showed no improvement in ability, but that can be like, if any intervention showed no improvement in ability, that can be due to things that we didn't capture in our questionnaire or in our research design, or actually the intervention hadn't worked. So those are the limitations that you see in your research design. And there were interventions that had like moderate effect sizes. So then if you are thinking of rolling out interventions or solutions as fact checkers or as digital literacy trainers, then you need to think of like, where do you put your money? How do you get your like the most impactful the intervention in with whom, doing what? Those things you need to study. I think that some of like insights coming from this study as well. But interestingly, okay, you might say that whatever the interventions you do had only marginally improvement, but what we see that the control group, which the group that didn't expose to any intervention is declining or becoming worse. So then there is a need for interventions or solutions that one can argue. So should we take those small wins that certain interventions can give? So questions. And so as I told you, we don't think that this is the perfect research. Which could capture everything, because the whole ecosystem dynamics we could capture. So if we had unlimited money, unlimited time, and also, all the barriers are not there, then we would rather study social media users in their natural environments, and we'll consider in our research all the external factors that might have impact on people's ability to identify misinformation. So that includes how do you like it can be scraped data from different platforms, or how do you monitor their behavior, like it can be online or whatever the methods you use. So all that need a lot of money and time as well. So we admit that limitation. So this is my last slide. So we thank all of these our partners, survey partner, SRL, and Watchdog for designing cue cards, and all other partners who came on board on interventions. Right. Yes, Helani.
We can take questions. Yes.
Hi, thank you for covering a lot in 40-50 minutes. Really concerned that there is high levels of trust relatively in religious institutions, given that they have been across denominations and faiths, hotbeds of originating ethno-religious disinformation. Just wondering, what happens now? There are some interventions to train people to be more skeptical, more vigilant. What happens when such trained people, their skills meet dogmatic beliefs or identity, which are like beyond logic, beyond reason? So when these two clash, which prevails? I know it's a bit of an open-ended question, I'm curious.
Ane, the simple answer is I don't know. If we could answer that, we can kind of figure it out, right? I mean, I know there is if you're reading, I forget Smigrod and sort of the new research that's coming out, it's not just dogmatic, it's neurological. It's actually at the neuron level, right? So some of the latest and greatest research shows there's something inherently willing and open versus closed and pre-wired. And some of, obviously, like all neurological things, they can be trained with behavioral dynamics, but not completely. I actually don't know the answer to your question. As a researcher, I can say that's not what we tested. But just as a Sri Lankan, if we could solve that problem, yeah, sure. Great. The mic to Kumar.
I mean, a great research. I think it gives us a lot of input and feedback to a lot of fact checkers or those who are intervening in this area. So I think it's wonderful work done. Congratulations on the research job well done, Helani and Isuru's team. I know, like, we didn't bring the Tamil consumers' perspectives here, but I'm sure you all would have had a glimpse of it, right? I mean, it might be possible officially to kind of share things, but do you see kind of a difference in regard to the patterns of behaviors between the two communities?
Okay, one answer is because the cue cards were different, we can't compare the outcomes of the training. Scientifically, that would be wrong, right? I mean, the scientific method says you change one thing, keep everything else the same. So that's why we split. We presented the research actually at the University of Jaffna Tuesday. We just come back from Jaffna, where we talked about the Tamil findings. And there, for example, we didn't see this problem of, remember, climate-related things don't change. People seem to not learn about climate misinformation even after these trainings and all of that. We didn't see that. Climate also improved, interestingly. Most things improved, right? So again, why we don't know, we didn't compare the two. What we can compare are the non-cue card based questions of the survey. So Shenali, can you maybe just talk a little bit, because I mean there weren't that many differences in terms of cognitive thinking, system 1-2 thinking, openness, etc. Maybe can you just talk if there were any differences between just the groups of people?
Yeah, so like Helani said, there weren't many differences between the two. I think one major difference that I saw was the trust in institutions was different. So you saw in the Sinhala news consumers, they had less trust in the government and the police. But interestingly, in the Tamil news consumers, they had more trust. And they had more trust in the national government and in the police too, actually. So yes, it could be, yeah.
Yeah, so a lot of this obviously could be, what are they called, Hawthorne effects or something, right? The fact that you're studying them, people behave better. Like, I mean, even us, I to say they all check before sharing, right? That could be because somebody is asking whether you share. That could certainly well be. But interestingly, like at the event, like we had like Professor Raghuram from the University of Jaffna, and I mean, there was a little bit of confirmation that, yeah, like even after all our baggage of the ethnic conflict and all of that, there is certain levels of trust in institutions which are not intuitive to us, which was interesting.
Thank you. On the fact checks, I think it was an interesting finding that there was a lack of appetite to read text-based fact checks, or how it was delivered to them. Was there also insight into what type of fact checks they then liked to see if it's not text?
So, no, yes. So, especially like they want to fact check only what is like closely like relevant to them. So, for example, like if someone wants to know like what's the interest rate for savings, right? And what's the procedure to buy a vehicle or something. So that sort of those are their personal interest at that time, because they are their behaviors and what they want to do in their life is closely related to that. So rather than like checking each and everything which is on fact-checking websites, they would rather have like personalized interest and also personalized methods of checking those facts.
I just want to add, I think like Kahneman's, like Nobel Prize, etc. on System 1-2 says that you need a lot more quantitative and emotionally appealing information to change the mind of somebody who's made up their mind with that gut instinct when they first see it, right? So which tells us something about how we maybe need to communicate to people to change people's heads. So just showing the fact is not enough. There's a lot more that's ingrained in your brain, and those System 1 thinkers need more evidence and more appeal to emotion kind of thing, right?
Yeah. Hi, first of all, thank you so much for the presentation. Any insights on how likely I think you conducted the post-survey interviews as well. Any insights on how likely people are to actually go to like any fact-checking websites and verify things? I'm asking that because like there is a lot of the times as an individual, they don't really go and check whether this is like verified or not. So would they actually go and look for those things, or would they prefer something like, for example, I'm scrolling or whatever, like we have commentary notes, would they prefer interventions like that?
I'll just say we had a question on, have you ever done any of the following before? Used a fact-checking website. We didn't show it. Shenali is frantically trying to find that. We can take another question while she finds that hidden slide. But there is a question. I don't think it was a preference question.
Okay.
It was, have you done this in the past question, right?
Okay, cool. Thank you.